All right, welcome back to the STMCA podcast where we talk about some of our local flavors of medical questions. This is Craig Thomas, I'm MD3.
And I'm David Cromp, MD2.
And this discussion is just going to be on restraints, just a couple thoughts on how we use them, when we use them, and when we should not be using them. And we've recently got some new restraints here at the STMCA. There's some really good videos online and on the STMCA website where you're able to see how they actually are used. But obviously, if you get a chance, you should practice using them. And if you catch any of us, we're happy to walk you through it as well. But you want to walk us through some of the reasons you would use restraints?
Yeah. And before we get too far into it, I think it's also important we talk about how we use them. And the biggest thing I think when it comes to restraints is always make sure you know how they work and make sure you know where the keys are. Those are probably the two biggest pitfalls we see in the field. But the basic different kinds that we use in the rig are either medical restraints and behavioral restraints. And I'll tell you a little bit about the medical restraints. You commonly see them in an intubated patient or like even you could consider a posy belt a medical restraint, anything to help you keep a patient who may be a little bit altered or just remind them so much, but they're typically not for aggressive patients. Positioning is a little more variable with medical restraints. Typically you hear one arm over the head, one arm down, but if they're not really agitated and they just keep reaching for stuff or something, then medical restraints have a little more leeway in how they go.
And then behavioral restraints, obviously similar. We're going to be using kind of a 4-point, usually, straps that will go down to the bed, and this helps prevent the arms and legs from moving. It keeps the patient safe, but also keeps you guys safe on the road. And a lot of the times these are for patients that either have psychiatric illness or are intoxicated, and we want to be using restraints, again, to keep them and you guys safe.
Yeah.
And the other major topic of discussion is handcuffs. While that is a restraint, there are certain times when they're acceptable, and there are certain times when we really want to get them out of handcuffs and into one of the medical restraints that we have.
Right. So we actually, again, we keep having all these conversations. We should just record them instead of doing this podcast. But we were talking about it, and really the most applicable time to use handcuffs is when the police tell you that this is a prisoner being transported. That's pretty much in our protocols the reasoning to do it. If they're going to transport a patient in handcuffs, it's recommended that the police officer be in the back of the vehicle with you. So however you can swing that. And again, as always, make sure that you always have a key handy because it's not okay to take a patient who's restrained and no way to get them unrestrained if you have to.
Yep. And so what I'm hearing basically is if we can get the handcuffs off and police are there and agreeable, that's definitely the first option and first one we would like to go with. But if they're under arrest and the police officer is adamant that a handcuff has to stay on, then the police officer has to go with the crew. And if there's any questions or concerns with any of that, please get a hold of us.
Yeah, absolutely. Always happy to kind of discuss the finer points of this. So.
Yep, restraints are definitely something we use a lot, and that goes along with kind of chemical sedation as well. So if anybody has any questions, just get a hold of us, and we'll see you on the next podcast.
Sounds good.